So there's the mic. This picks up whatever cracks and sounds and rubs and...
I get a lot of cracks from me.
Do you crack your back regularly then?
Yes, I do.
Okay, what are you mostly cracking then?
I can crack through my upper back all the way down to my lower back.
Wow, most people can't get their upper backs to go.
I'm pretty loose because of my ribs that I've got removed.
So where did they remove the rib? Like what part of it?
So they're right behind my collarbone. They removed the entire rib because my first rib and collarbone were crushing a vein. It's called thoracic outlet syndrome.
Yeah.
So...
Was it giving you tingling into your arms?
I actually had DVTs and my entire arm had no blood flow coming out, only in. So my muscles swelled with blood. So I kind of looked like the Hulk for a couple days.
Okay.
So yeah, that's my...
So you had DVT, like deep vein thrombosis?
And pulmonary embolisms. It caused pulmonary embolisms, all that. So.
Oh my goodness. Have you been better than after?
Yeah, I got a stent put in this side because the vein collapsed after surgery, but now that I have the stent,
It keeps it open?
Yeah.
Pretty good. Okay. All right. And have you had any complications from it?
Yes, quite a few. So the biggest thing, I don't know if it's something we could address, but I get very bad neck spasms, and it's not like a normal spasm when So, like, say I'm eating something and drop something on my shirt. If I go like that, my neck will tighten up and I can't move my neck. I get completely stuck in a position for a couple seconds until it finally releases. And that happens on both sides.
Do you notice that your hand cramps?
I get spasms in my chest area, right about in here. But other than that, no. I don't get many other cramps or spasms.
Just the neck when you do a sudden... turn.
Yeah.
Just down and to the side.
Yeah, it's mainly this. I can feel it right in here, like the tightness, and then same right in here. It's the same side.
Okay, so the chiropractic adjustment, it just helps mobilize segments. Muscle spasms, it depends on what the cause of it is. So you had one removed and then two. The second one?
No,
T1 and T1?
Yeah, T1 and T1.
On both sides. Okay. So they removed one and then they had to go in and do it to the other side.
Yeah.
Did the same thing happen to the other arm? Like, why did they only do one side first and then wait and do the other side? There must have been some reason, or...
It was because I was a case study. They'd never seen it before. I had to go see a special doctor. This was when I was in Illinois, so they had to send me to some... specialist, and then he was able to determine it was the thoracic outlet syndrome, and they didn't see any signs of it on this side, but then a couple years later it came back onto this side, and so we had to go back through the same process.
Okay, so bottom line is, though, it's helped you and it hasn't come back, right?
Yeah.
Okay, so it needed something, the rib was just pushing onto your arteries and your veins, and it was just squeezing it, and then it just was pulling in your arm.
Yeah.
Okay. The joints are still there. They didn't remove your vertebrae.
No.
Okay. What I'm working on is on the back.
Yeah.
So these right here, they come like a little collar, and they go up over your lung, and they help you protect your lung. But sometimes our organs don't fit our frame.
Yeah.
So do you have like any trouble breathing or?
Sometimes. Most of my breathing problems though are because my lungs are compromised from the pulmonary embolisms I had.
Ooh. Okay. Are you on blood thinners at all?
I was for about 3 years, but I'm off them now.
How long have you been off of them? For a few years now, then?
A few years.
Okay, I'm just making sure you're still okay, because this is pretty intense, and if you haven't had, have you had a massage? No. So, we're going to do it step by step then. Okay, I'm going to do it one thing at a time.
Most important thing is definitely my posture. You can tell
You're slouched, yeah.
Yes. It is extremely hard.
To get back?
Yeah, because everything pulls forward after my surgeries, so I do my best to lean back, but it's in my neck, I feel it pull down, and so I'm always kind of slouched over.
Now this is where we want to take you.
Yeah.
Okay, and that hurts to do that?
It doesn't necessarily hurt, but I feel it pull, yeah.
Point for me, point where you feel
So
pull.
I actually feel it right here.
Okay. Well, there's T2. Okay, here's T2 rib. T1 is like a little collar that goes around like this.
Mm.
So let me see how much of it you have. T1 is real tiny. It's up at the top like that. It's a little collar.
I was told not everyone even has that in rib.
It's like, I guess cavemen used to, hit each other over the, things would fall on us, and it's a protection. It protects that apex of the lung up here.
Yeah.
You still have it back here. Look, it's still there.
That's interesting.
Yeah, have you seen an x-ray of it?
No, I've not.
See, you still have part of it. They didn't remove the whole thing. It feels like they still left part of it. Yeah, there's the end of it right there. They only removed this part, all of this. There's the end of it.
Oh, that's crazy.
You feel that? That's where they cut it. So they left you some protection. You're not completely without stability back here.
Yeah.
They just opened it.
Hmm.
It's a triangle like this. So they just unlocked part of it.
Okay.
The scalenes. There's no rib in here. I don't feel, usually you have a rib in here. But look, there's the end of it. That's about where the end of his rib is. You want to feel that? This is where they left you this piece over here.
Oh, that's so weird.
They left you this, all of this they left, which is great. I'm glad they didn't remove it all.
Yeah.
I'm glad they gave you something here. I know it's sore because there's a muscle that you still have. I was wondering if maybe if T1 was gone, he wouldn't have the common trigger points that most people have, but they left just enough that you're going to get the trigger points, okay? He's still going to have all of this that everybody else has, okay? But really, you just feel like you've collapsed forward.
Yeah.
There's the scar from the surgery there.
I have two, one down here as well, because they said I'm making a cut through my rib. And so I got hard bones. So the second time I only have one scar. They figured it out.
It does disappear a little bit still when I bring your arm back. I'm going to change your posture a little bit and check it again. I know this is uncomfortable, but let me see if that opens it or closes it. I know, ow, sorry.
No, it's fine.
Yeah. You should test it on yourself. Can you feel my fingers? Can you feel your pulse against my fingers beating?
Yeah.
See how that beats? Boom, 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 boom. Now slouch forward. Slouch again. Like, we fixed your posture already. You were like that. It's gone right now.
Yeah.
Okay. You see what I'm saying? So we have to get your chest out.
Hmm.
Yeah. Strong pulse here. Weakens. It's strong here. Chest out again. I know. I'm going to have to train you. I'm going to have to train you to do that. That needs to feel strong. 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 Strong pulse. Yeah, I can feel it. You really should feel this. It's pretty cool. All right, I'm going to go into here, all right? Let me see what I feel. Take you a little forward. Nothing feels out of place. This has just been split. A little scarred. You can feel a little scar tissue in here. But it's not bad. Yeah, he's got it like, oh, that's right where the cut is.
Mm-hmm.
You know. I didn't even check. You can feel it though.
Yeah.
But it's all in place. All of your scalenes. SCM is right here where it should be. Here's your anterior scalene. You can feel them all, which is kind of cool. Anterior, medial, posterior, traps, levator scapulae. Got them all. They're all there.
That's good.
They're all in order. They're all where they should be. And you still have a trigger point where everybody else does, even when you have no rib to cause a spasm, you still got one. Sorry, you're totally normal. You still, now is that hurting you at all? Because I'm going, that is kind of a cut piece of bone. It's almost like down, like these guys down here. Can you feel how sharp that is down there?
Yeah.
Because it doesn't connect to the cartilage here.
Yeah.
Your false ribs down here are like kind of sharp. They have edges. You kind of have an edge over here, so I have to be careful that I'm not. That's the only thing. That's almost what it feels like. Like we've created, we've created a floating rib up at T1. Yeah. Other than that, get it. There you go. All right. See all that? I was hoping maybe we wouldn't have it, but I was like, there's no rib to cause it, then maybe you won't have it. No, you still have it. All right, on the other side. Oh, that's night and day. This side you have nothing. No spasms at all.
Really?
No, it's completely soft, like pliable on this side. It's fascinating. All on the left. All of it.
That's surprising to me.
Look at this. This is all excellent. Plenty of motion over here. I'm going to do a test, okay? I'm going to take you back. Does that hurt? You okay?
No, it's fine.
Okay. And then I'm going to ask you to open up your eyes. Any dizziness, vertigo?
No.
Okay, you can close them again. Whatever makes you feel comfortable. It's pretty tight up at the top, but the lower neck feels great. Here we go. Top, right here. Very good. Anything hurt when I did that?
No.
It's all that it moves. The other side, chin back. I think you've already gotten these, huh?
I might have.
Yeah, I think you already moved them. It's all right. It's just me trying to figure out. They're still really stuck. I don't think it doesn't feel like you get these. You push them the other way. Look, I want them to go that way. Ooh, does that hurt?
Mm-mm.
No? Okay. You let me know, okay?
All right.
I'll stop asking. But just let me know. That's already kind of gone. There you go. It'll let go eventually. I just keep telling it to. Yeah, there you go. There you go. You did it. I gotta stand up here. There it goes. Okay, we got left. Do you mind having your shirt off on your stomach?
That's fine.
Is that okay? Okay. There you go. Make sure nothing's hitting your face, like the wood isn't pressing on your face and it feels okay. You feel pretty flexible. Here you go. Take a deep breath in. All the way out. Okay, that was a trial. How did that feel?
It felt good.
Yeah, you don't have to be scared of us. Any pain when I do this?
No.
Take a deep breath in. Perfect. Excellent. Same thing, other side. Any pain when I do this?
No.
Okay, deep breath in. Excellent. Does that feel okay?
Yeah, it feels good.
I'm surprised. Most people that haven't been worked on, they usually are like, no.
Even some who have.
Yeah, even some who've had like massage work done, they're like, no, don't touch me. Like, okay. I guess you knew, huh? You probably saw the YouTube video and you went, I think I need that.
Yeah. I've been watching it for a while now.
Good, good. I tell myself, breathe. Some of them released in the lower back there. Just gonna push. Does that feel okay?
Mm-hmm.
Oil, okay, oil. This is just so we don't hurt your skin. Are you okay with the bruising?
Yeah.
It goes away in about 7 days. 4 to 7 days. Even that's a surprise, I would have thought.
The other way, when I was on my back, they were going a little numb.
Really?
Yeah. This is more comfortable, though.
Okay, good to know. Good to know. See, I don't know that until you tell me. No, there's nothing here. No adhesions. Your skin is really flexible, though.
Yeah, I have very stretchy skin. I'm not sure why.
Well, have you ever heard of like EDS?
No.
You might have, but your joints aren't super flexible, so I don't know, just your skin. So there's different forms of it, and one of them is like your skin being really flexible. Doing okay?
Yeah.
Sorry, Linnea, you're having trouble with that chair.
I have to change tripods.
Just change it. I want to get this part pliable so I can bend you backwards, basically.
All right.
There you go. Perfect. Perfect. Feels good. Breathe and exhale. In. Pretty good. So more oil. Here, you can tell me. Okay. Do you feel it?
Mm-hmm.
It kind of just cuts through that superficial, that first centimeter. Does it hurt too bad?
Mm-hmm.
It just, from everything that you've been through, I don't think it's going to. I think it's always surprising at how much, even with everything that we go through in life, how much of this type of therapy we can actually take.
Yeah.
This is all soft tissue. Joint mobilization. It's not as scary as people think it is.
Mm-hmm.
It should feel almost natural, like a natural thing to do.
Yeah. I think everything's felt good so far.
You've been what?
I think everything's felt pretty good so far.
Yeah, it should feel like, oh, okay, like this needs to be done. Yeah, that makes sense. Your upper shoulders don't actually feel too bad. Where the thoracic outlet is. This is the thoracic outlet. Well, it is a little bit worse here again on the left. So I know, it's matching what I'm feeling, I guess. So tuck your chin for me. Like just tuck it, yep. How far does this go? I'll find him. Okay. Hardly any petechiae up here. Fascinating. Like, you know, like it's all mid back down.
Weird.
Does it tickle? Does it tickle?
No, it's fine. It just
Feels weird?
yeah.
Alright, arm behind, yes. We're just kind of like that. Open up the chest. Yeah. Now, how does it feel to do that now? Yeah. Alright. Head goes back. Look back. Good. That's all it's gonna go. Other side. I think we got some of it. Now this side feels really out. There it is. Perfect. Cracking toes. Ooh, these are stuck. I found one tight spot on your body, right? Just one. Oh my goodness, your ankles. Okay, flex. Good. Oh, that's tight. Good. The little ones go. Do you crack these yourself? Oh, there it goes.
I usually I push them down and they crack.
Oh, like that.
Yeah.
Yeah, I'm doing a long axis. You know about that. You know XYZ. So we're just doing one direction away. Y axis. Away. When you do XYZ and you curl them, that's kind of crunching them. I'm separating.
Okay.
One tight spot. That's it. Your knee feels, everything else feels fine. Okay. Good. Elbow back. Good. It already went. And lean away. Dead end. Why do you have dead end on your?
That's like an aesthetic thing.
Is it because of the? Like I was thinking, like maybe the clot, the throat, or I don't know. There you go. Oh, let's do the shoulder first. I think they already moved, but. Oh no, that one didn't.
Surprised me.
Good. Yeah. But does it still feel tight in the front? Like, what does it feel like? Can you explain it to me? Just pulling in the front?
Yeah. It's.
And it's since the surgery?
Hmm.
Is it hard to swallow?
Actually, I can't gargle. The way that they rearrange my muscles, I can't gargle water anymore, and that's a weird fact, but I choke on my water if I try and gargle it. So I don't know what they say.
How about yawning?
Yawning, I don't have
Like-
any issues yawning.
Like just yawn for me. I don't think it's muscular. I think they might have hit a nerve.
Really? Because I did lose. I've lost most nerve feeling from about here up.
You can't feel?
No, not really.
Like you can't feel this?
Not really. I feel like the skin around pull, but I
And how about here? Can't feel that.
at all.
Yeah, I because your muscles are not in any weird shape or form. I don't think it, I'm wondering if they went in and hit like a cranial nerve. It just happens.
No.
And now, and it would have rewired if it was going to rewire. So the pulling that you're feeling, can you do this? That's a little weak, right?
Yeah.
Right. See how it shakes a little bit on him? So yeah, the facial nerve, that's cranial nerve 7 even probably got a little cut when they went in.
Yeah.
So you might have a sensation of pulling, but it I don't feel like anything's pulling. It's just the left side is a little bit spasmodic, but is it painful? Do you feel pain in there?
No,
Just tightness.
No.
Good. Now you're gonna look towards me over here and turn your head, like all the way. Does that hurt your neck at all doing that?
No.
Do an old toggle move here, okay? There it is. All right. Now back down again. That hurt at all?
No.
All right. Good. All right, that's as much as it moves. Come on up. Posture is 100% improved. You want to take a picture of him? Just how he's sitting here? Like, okay.
Slid up straight like that, bro.
You're capable of it. Okay, it's not like you're permanently flexed forward. You have incredible flexibility. Like, this shouldn't, no, of course, I've been beating you up back here for the past hour.